Let's formally welcome Dr. Michael Eburn, who is going to start by talking to us about the current scenario and what differentiates the ethical and practical issues in regulating the population during a huge global scale biosecurity emergency from perhaps a more limited local scale emergency like natural disasters like fires and flood. Over to you, Michael.
The questions that I've been asked to consider is, what's the similarities or differences between the current event and disasters that we're more used to, fires, floods and storms? For years, we've had emergency management legislation that have given members of the executive government extensive powers to control behaviour, whether that's the commander of a fire crew in a truck at a house fire, up to state controllers during declared emergencies. They have powers to close roads, order evacuations, in some cases to order people to remain in place, to undergo decontamination, to forcibly enter premises, a wide range of powers. But we've not seen anything like we're seeing in the current crisis. And I think there's a lot of reasons for that. First of all, no matter how big fires or floods are, they don't affect the whole population. Even when we think we have a national emergency, like we did in the past summer, 2019-20, the current COVID crisis puts that into context, that it really wasn't a national event. It was affecting lots of local communities. So we don't need the sort of widespread regulation that we do. Another major difference in those events, and while it's not universally true, is generally what people are trying to do is get people to leave. And that creates its own dilemmas. If you want to order everyone to evacuate a place, they're leaving their home, they're leaving what they hold near and dear. And they clearly want to go back because they want to try and protect property. They want to see what's happened to their property. If they've left animals behind during a bushfire, they need to go back and look after them. So you may want people to leave, but you don't want them to leave for very long. And one thing that fire and emergency services have learned is you need to be flexible in letting people back. And so that's been a big problem they have with roadblocks and things. They can't just say no one's allowed in. People have legitimate reasons to get in and people will go around them. That's quite different to the current event where what we're asking everyone to do is stay at home. So that may explain partly why we're getting what I would call what would appear to be fairly significant compliance. It's quite different to ask someone to stay in their premises as opposed to leave them. And we know from the fire and emergency services, if you want people to leave, pets and things are a real problem. Here, if you're staying at home, you can still feed the cat and the dog. So I think there are some very significant differences. Another really critical difference from an ethical perspective is when you ask someone or direct someone as one of the emergency services to do something like evacuate, if they choose not to, the person they're really putting at risk is themselves. The fire and emergency services might say that it carries some risk to them if they've got to go and rescue people, but they don't actually have to go and rescue people. If they've said this is an evacuation zone and we're not coming in, and we've seen that at times where they say we are not coming, you are on your own. So the person you put at risk by ignoring an order to evacuate in the face of a fire or flood is predominantly yourself. And so there's much less ethical justification for using force to compel compliance. Whereas what's going on here, of course, is if you don't comply with the directions, you're putting other people at risk, and that limits our own rights of freedom and increases the state's interest in enforcing the measures. You're not only risking your own life, you're risking other people. So there are some really significant differences there. I think something that is probably common, but again is a bit, we're seeing more of a swing to the use of force here. The Australian Defence Force are helping secure premises, though I'm told by people who know what's going on with the military that this is still being considered what they call defence aid to the civil community. There's a difference between Defence Force aid to the civil community and Defence Force aid to the civil authority. If it's Defence Force aid to the civil authority, that's the ADF using arms and force. Presumably the ADF that are currently helping, whether it's monitoring self-isolation or not, are not actually carrying weapons. There's a real limitation. I mean, I think there's a real fear, and certainly in the fire and emergency services, of using force. They might have the power to do it, and there is legislation that says they can do it. And you can imagine a firefighter might use force in a single instance. You know, you want someone to evacuate a. Consider that the tower fire in London, that terrible fire, and you might have someone and you say you've got to go, and they go, I'm not going. You go, well, I'm not going to argue with them. You just pick them up and carry them out. Now that sounds easier than it is. Of course, moving people is really hard work, and most fire services are not going to do that. They're just not going to waste the resources. If they knock on your door and tell you evacuate, and you say no, they're not going to waste a firefighter's time trying to get you out. As I said, you can imagine it in a really simple one-off. You know, it's just easier for me to pick you up and move you than argue, but that's quite different to a community thing. So there's a real reluctance, I think, and there always has been, to use force even when it's permitted. And certainly my impression that I get from work I've done with the ADF is that there's no chance the ADF wants to be seen to be going into communities armed and using armed force against Australian citizenry. So seeing the ADF securing premises in this current emergency is quite different to what we've seen them do during bushfires, where they come in with engineering, or we saw them in the current last summer providing transport and logistics. So there's a real subtle shift there, I think, in the way the ADF are being used, noting that they're still not turning out with guns and bayonets fixed. A question that I was asked to consider is, what lessons should we be drawing from the current situation from numerous previous inquiries, particularly around enforcement? Enforcement's never really been let me backtrack there. Enforcement's not been a big issue in Royal Commissions and inquiries. I think the two critical lessons that have come out of past bushfire inquiries about enforcement has been about roadblocks and the need, when you're going to enforce these sorts of things, to actually be flexible and think about it. Again, police have been much more willing to enforce roadblocks into fire areas because they don't want people going in and dying. But they've had to come to grips with letting homeowners and property owners back in because they really have legitimate interests. We've seen that to a certain extent in the current crisis with the way the orders have been phrased and exceptions for, whole lists of what you're allowed to do. But it's certainly, again, from just being an observer of the media, that some police forces are being pretty belligerent about getting out there and enforcing it and issuing fines. I think if there was a lesson from past hazard inquiries, it would be flexible, be thoughtful, genuinely think about what people are telling you and ask yourself, is enforcement the right way to go? People really do have legitimate reasons that may not have been put out in a list. The other lesson that I would draw, or at least think about, it comes out of the West Australian fires of 2011, where the fire services evacuated a large part of a population and were really very pleased with themselves because no one died. But were subject to criticism because what they'd done was inconsistent, according to the Kilty review, with ideas we have of building resilient communities. The communities need to understand risks and take responsibility for managing their own risk. And if you force everyone to evacuate, you're not allowing communities to be resilient. So the issue there was, had people been allowed to stay and defend, a lot more houses would have been saved. So they lost a lot of property that they didn't need to lose. So what's the lesson here? I think it's interesting to think about how we're going to respond to this and future pandemics in encouraging resilient communities. And part of the way to do that is probably a bit more of a softly approach. You might have the law in your background, but actually, and we're seeing it, the conversation about how we're all in this together, we've got to do this together, rather than the simple, you have to do this because I'm telling you. That's much more likely to build compliance, but also to build more resilience for communities to come to that, understand their own needs and how they're going to respond to events. I think fundamentally, though, the lessons are going to go the other way. It's, what are the fire and emergency services going to learn from this event in terms of being able to set out orders to whole communities that are largely being complied with, and what can they learn about how this exercise has been done and how people have been brought on board and people have done what they've been asked to do, and how will that lessons be translated to the next fire or flood? I think that's actually going to be the more interesting question. And look, I note my time. I'm at 9 minutes 40 according to my clock, so I'll stop there and hand back to the chair.
Thank you so much, Michael. That's a lot of food for thought there. I might just ask you a quick question around things like communicating complex information to the public in emergency scenarios, and particularly here when you're communicating on a mass scale to everyone, not even defined people in defined areas. Do you think any of the lessons of previous management of natural disasters have been learned? Can you see them in terms of risk communication and thereby encouraging the population to comply voluntarily?
I think that's an interesting question. There's been a huge amount of work done on that idea of risk communication. It's really come down to simplifying messages constantly, which is why we now have the national fire warning standards, and we all hear about a fire being at alert or watch and act or emergency level. 3 clearly defined. I don't think we've got that here because this is all new. So no, I don't think you can see it in that sort of clear messaging. We've just seen Commissioner Shane Fitzsimmons from New South Wales Royal Fire Service leave that post to take up a job as Commissioner of Resilience New South Wales. Well, I mean, he was becoming an expert at that, very direct, very clear communication, and I'm not sure we're getting that as well. But certainly they're struggling. I think one of the important things that's come out of this is the whole bipartisan approach, that we're not seeing arguments, and that the people who are delivering the messages are either the chief health officers or certainly giving evidence-based, and I think that's helping. But no, I don't think we've seen that same simple messaging. But the fire services have been working on this for years, and they have, of course, one hazard: it's going to be a fire, and the flood for SESs have to deal with the storm. I think the interesting thing is people talk about how hard Surf Lifesaving, what a hard job they have at getting their message across, and their message is simple: swim between the flags. And even when it's that simple, it's hard to get people to hear it and know what it means.
And another question we have on Slido relates to the time scale of the disaster. And usually in a fire, you're talking about something that has a more defined time scale, whereas the time scale for the current emergency is indefinite as far as we can see into the future. Do you think that affects the whole approach to risk communication and indeed risk management?
Oh, I think it has to. And I think it has to also affect the way people comply. I mean, if you're told to evacuate from your premises, even if it's for 2 or 3 days, assuming your premises don't burn down, then you go back and it's over. I think the other really significant difference between this and the natural hazards is if you take a fire, you can see it. So for some people go, I'm definitely going because I can see it's there. But other people will go, I can see it. I know where it is. I can defend because I can see it coming and I can see it going. And once it's gone, it's gone. It's not coming back. It's burned out all the bush. So I think that is going to seriously affect the way people hear the messages and respond to them.
Thank you, Michael. I'm now going to hand over to Cameron, and actually Cameron's topic is very relevant to some of the questions that are coming in, which is that it feels like we're all of a sudden subject to a whole raft of what feel like quite draconian powers and restrictions on people's everyday freedoms: freedom of movement, freedom to ply your trade or business, freedom to travel more broadly or locally even. But is this something new? Are these relatively new laws, or are these what we are seeing now a manifestation of laws that have been on the books for a long time but haven't needed to be invoked? So with that, I'll hand over to Cameron to start the discussion.
Thanks, Pauline. And thanks and welcome to everyone, and thanks for everyone's attendance. And it's great to be talking with Michael again after many years. These laws are a part of a general scheme of laws that we've had for, well, hundreds of years, to be honest. And most of them can be traced all the way back to our controls over leprosy. So they're medieval in origin, but the modern draft laws really originated after the Spanish flu epidemic in 1919. And so after that, it was sort of handled rather disastrously by the different state and territory governments and the federal government. And so after that, a sort of new draft tranche of laws began to emerge, and we see them in the modern public health laws. But mostly they're dealt with at state level. So the experienced public health regulators are state-based. So we've had public health laws. They normally categorise diseases according to their severity and risk. And according to the different category of disease, there'll be different regimes for compulsory testing, for contact tracing, and then there may be particular control orders that may then emerge about those diseases. So, for example, during the HIV epidemic, HIV was categorised in New South Wales as a Category 5 condition, which is on its own, actually. It was so considered to be so special that and exceptional that it was given its own condition. Category 4 and 5 conditions allow for a number of orders for compulsory testing, for compulsory treatment, even to the point where you can be controlled as to who you meet, who you have sex with, what places you're allowed to visit, for example, nightclubs. And you could even be placed under effectively house arrest. So those laws have been around for at least 80 years in different versions. What's new this time is the fact that we've got the federal government trying to enforce some of those laws itself. It hasn't traditionally done those functions. It's really just controlled the border and quarantine. But under the Biosecurity Act, which is the 2015 Act, it's been given itself similar powers that the states have traditionally exercised. So that's the main difference. The sort of second question I was asked was about the notion of policing and what would effective policing be in these circumstances. And that's a difficult question because it is very different from what Michael was describing. I think Michael hit the nail on the head when he said, well, in the disaster regulation, it's really individuals. If they make a decision which contradicts the state's decision, the danger is only to themselves. It's very different here because if you make a decision that you're not going to socially isolate, there's a chance that you could infect other people. So there is a level to which the laws could tend towards more utilitarian bent and be more draconian. And you can see that starting to happen now. I think the problem we've got is the one of communication, which again, Michael has talked about. And I think Australians would generally be pretty compliant if they're given very clear communication. And we haven't, I don't want to be critical of current public health workers, but I don't think the communication has been as clear as it could have been. And I think we really need a national pandemic stage framework. So we could talk about, stage 1, stage 2, etc., and then have that set out in very easy to understand charts. So that's something I think we'll definitely build on in the future. But that would help the communication, just like the bushfire plans and other things. The bushfire levels have become very clear in recent years. I also think that the communication at the beginning was done by politicians, and I think that wasn't as effective. I think as we've gone on, more and more the public health officials, the chief health officers have been speaking, and I think that's been for the better. Having said that, having a unitary sort of voice is preferable. And again, we're kind of a bit at the mercy of the miracle of federation. So we've got each state and territory and plus the federal government all making sort of proclamations. And I think it's caused a bit too much churn in the communication level. So communication is key. Policing is also key. We've got to be really careful. I think people tend to think we're compliant, but we also have a bad history of social disorder when it comes to policing. And policing, just general policing of public spaces and other things that gets out of hand. So we've got quite a long history of riot and public disturbance, and we don't want to be going back to that. So I think it's my preference would be to show the stick and throw it around a lot, but don't actually hit anyone with it, because it's only going to take one bad policing event for public opinion to shift rather dramatically. So I think we need to be really careful with the policing and make sure it's softly. You have the big threat and say, you'll be fined and blah, blah, blah. Keep hammering that message, but be very careful of the actual front end policing that it doesn't get out of hand. And there's always that danger. As much as I love the police, the individual police, their skills vary, and this is a new thing for them. So we need to be very careful with that. And there's always that undercurrent of public disorder that we've got to be careful about. So I'll hand back to you, Pauline.
Thank you very much, Cameron. And, that's a lovely segue into a question that I've been thinking a bit about, which has come from Slido. which is, can you tell us a bit about the precedent for using these powers, and very broad powers are vested in the executive under public health and biosecurity laws, without the usual checks and balances which would apply where Parliament would have more oversight over these. And in fact, Parliament doesn't even sit that often. So would you care to comment on that?
I suppose the main precedents that we get are mainly from the sexually transmitted diseases, so particularly HIV. That's our best experience. There's some experience as well of other transmissible diseases, for example, like tuberculosis. So there are examples of patients who are non-compliant, who refuse to be treated, and then who are going out into the populations and spreading disease. But we're talking about a handful. We're talking about maybe a dozen in the last 10 to 12 years. So probably the most well-known example, notorious example, is that of Neil, who was a Victorian man who had HIV and was completely non-compliant and actually engaged in behaviours where he was deliberately trying to infect people with HIV. And so they're very bad actors. And I think having a very small sample size, it's hard to draw any conclusions about the effectiveness of those regimes because they're just too small. We really haven't done much of this.
Actually, you raise a really interesting point, because public health laws with their broad powers are scalable. They can apply to the individual, they can apply to groups, and as we see at the moment, they're applying to all of society in effect. There's a very different approach taken to policing or monitoring or controlling when you're dealing with the behaviour of individuals, and it's quite limited in scale as to whole populations. You raised the issue that Australians are not terribly compliant people by nature, but I'm going to challenge that at the moment, because I think we're seeing huge scale compliance, of course, with some breakouts and with communication that seems to be moderating people's behaviour. And there have been some incidents where police seem, especially in New South Wales, to have been a little heavy-handed. Do you think that heavy-handed approaches risk undermining the goodwill that promotes voluntary compliance in the community at large?
Oh, definitely. I think you're right about the compliance at the moment. I think there's really good compliance and there's a lot of public uniformity of support. But like I said, one bad example, one bad police action could flip that. And then you might see, particular segments of the community getting really angry. And you just have to just do a Google search, do Australia, do riot, do public disorder. I mean, there's lots of examples. So the last one probably being the Cronulla riots. The good examples of everyday, ordinary people who normally are very compliant, very good, and then something happens and they get really angry and they do it in a way that other people then get angry, and it very quickly flips. So, maybe I think it's maybe not peculiar to Australia either, it's just human nature. Thankfully, we're not all armed. So I think that would add some extra spice to it as well. But we've just got to be careful that policing is sensible and it's very light-handed. And then I think the public support will stay.
I'm hearing on the grapevine that enforcement officers from all kinds of other agencies are also being mobilised to support monitoring and compliance. What do you think the challenges are for perhaps enforcement officers in, I don't know, OH&S or public health environments or other environments being drawn in to try and support the compliance monitoring effort in this particular scenario, with laws that a lot of them won't be terribly familiar with, and with perhaps not the training to apply them to the general community as opposed to obligated sectors of the community?
In the area of the infectious diseases, it's usually the public health officers that do this. It's not police. So the police aren't involved in these things. So there'll be some very highly qualified and very good, highly skilled people that could do this well. But if we're talking about, getting physiotherapists and occupational therapists and that's a whole new bag of dice. And I think that's a possible perfect storm and it has a potential to go off the rails pretty quickly.
Here's a question I'd like to put to both of our speakers, which is actually to say, especially when the executive is using wide powers across the whole community, how do we actually ensure that listening goes both ways, but that is between regulators and citizens, and that regulators can actually learn and adapt on the fly to the real life experiences that people are facing under what are really tough conditions, which are unprecedented in all our lifetimes?
My answer to that would be, I don't think you can ensure that happens. What you can do is hope that happens, and it tends to rely on the professionalism and goodwill of the regulators. And I think that's part of the problem. What Karen was just talking about is having police do that. I think it's really unusual that, particularly in New South Wales, the lead spokesperson has become the Commissioner of Police, and I'm just not sure why that's the choice. If it was public health officials doing it, there'd be more, or local government public health officers. They're much more used to listening to the community with respect to the police, and the police have changed a lot in recent years. I think university graduate police officers are really changing the way the police works. But fundamentally, police are used to telling people what to do and having them do it, and they're not very good at listening to people feedback. So I'm not sure that having police leading the charge is the way to do it. Cameron.
And what differences or challenges are we seeing in real life as different kinds of regulatory enforcement, policing, and even with the ADF being brought in to assist, being required to work together in a regulatory space to control behaviour across the population?
Do you want to go on that one, Michael?
I mean, I think it's hard to know from a distance. We're all still stuck at home too, exactly what those challenges are. They're things we'll learn in the background. From, again, as just an observer, which is all we can be at the moment, is it all seems to be going to well. I'm reassured, not only are we not armed, but that the ADF aren't out there with weapons. I think that would fundamentally change the world. It seems that, in fact, they're coming together surprisingly well. And I think that's part of what's getting us compliance, is there's no dissenting voices. If there were, then to pick up the point Karen made, then people would be much more likely, I think, to challenge it. But at the moment, the message is so consistent, even if it's a bit ambiguous at times, that's going to help with compliance.
Do you think?
Yeah,
sorry, Cameron.
I'd like to reiterate what Michael was saying there about the problem of using the police as the main message givers. They should be there, maybe in the background, but really concerned about the fact that the police commissioner gets to speak for half an hour on these issues. I don't think it's necessary. I think it's much better if it was explained as a sort of community effort. And obviously, we're going to need the police to do some of the policing here, but it's got to be community-based policing. And that really is about conversations of local groups and people from the area talking to other people from their area and getting things done that way. So bringing in the ADF, I would think, is a step that I should be very careful about. The ADF has a wonderful brand in this country, and they're well respected and they're loved. But again, you risk a lot by getting them to do things that they haven't had to do before. And one bad and recorded interaction with the public, I think, could threaten that brand really badly.
And
I think that's something that if we go back to other natural disasters, things like the fire services take really seriously. And one of the reasons I think they don't get into heavy-handed is they've got such good community standing. And when you're talking about the rural fire services, bushfire services, all those brigades of volunteers, they live in communities. There's no way they're going to want to go around and get tough with their own members. It's all about getting people on board to come with you. I mean, we may be speaking and to the same point, Cameron, constantly reinforcing with each other, but I too am terribly concerned that certainly in New South Wales, the lead spokesman is the police commissioner. I understand why. He's the state controller for disaster response under the State Emergency and Rescue Management Act, but he just seems like the wrong person to be pushing the message. And when you watch the message from every other state, it's not the police standing up doing the talking. The police are the arm, the health minister or the chief health officer might say, the police are here and they're going to back us up, but it's not police taking charge. And I think that's a real that's likely to be a real danger for New South Wales.
Yeah, he should be in the back waving, you know, hey, I'm next. Behave yourselves, kids.
Yeah, our troops are out there. Troops, you know, the police are out there, and they're going to back up what this person says. So listen to this person, not listen to me.
I just can't resist making the comment, though. There is intrinsically something in it for all of us to stop the spread of COVID-19. We're all potentially at risk, and our loved ones are at risk, which you would think would mean there is a huge amount of community support for agencies, even if they don't always get things right, as happens in an evolving crisis generally.
I think if I can make just this observation, because I'm not quite sure it fits, so I'll throw it in there. But it was in terms of that question about what lessons are there from the past events for this one. My certainly concern would be that the fire and emergency, as I said, it will go the other way, that the fire and emergency services will be looking at this going, my goodness, have you seen what they got away with and what orders they made? How do we get to do that in the next fire? And they'll be looking, so it's not, what can the current crisis people look to what's happened before and go, what can we do? It'll be at the next bushfire. They'll go, how did they get that level of control and that level of compliance? And how did they get away with those sorts of restrictions? And how can we do that? And that's where I would have some fear of the lessons learning from this.
Well, I would just add to that I'm not sure people will get away with a lot of things. I think every major disaster, and this is a disaster on an unimaginable scale, has its inevitable inquiries and look backs, and I think there will be some learning that will come out of this, and some hard questions asked eventually once we get through to the other side. But look, I want to thank both of you for your fantastic contributions. You've certainly given all of us a huge amount of food for thought. And to keep us to time, it's time to wrap up. So on behalf of everyone at ANZSOG and all the participants, according to my screen, there's 193 of you out there. Keep those questions and thoughts coming, and keep the feedback to ANZSOG coming if you'd like to keep the conversation going.